Hi, I'm Dr. Carolyn Alexander at Southern California Reproductive Center, and I get asked often, what is Polycystic Ovary Syndrome, or PCOS, or Pcos, or cysts? Why do I have cysts on my ovaries? Polycystic Ovary Syndrome is the most common hormonal issue that women face. 1 in 8 to 1 in 10 women have this issue. And what's interesting is it's been around and known about since the 1930s, when earlier scientists realized that there was something going on with the ovaries in some people who didn't get their period regularly. The ovulation doesn't occur as consistently in some women with polycystic ovary syndrome, and as a consequence, the menstrual cycle doesn't come out regularly. Not everybody has irregular periods, but that's one of the most common clues that tips us off that there's a hormonal issue that's being faced with. And the other issue that happens is high testosterone or high DHEAS, which is a hormone from your adrenal gland. And that can cause hirsutism, which is male pattern hair development, such as your sideburns, chin, tummy, lower back. And that can be very disconcerting to young women and young women of reproductive age, because that's where hair shouldn't be. And so that can be a smoke signal that there's high male hormones coming from the ovaries or the adrenal gland. And so it's important to understand how high are those levels, because there's certain rare things that can cause that too. And we want to be very cautious that when we call someone saying they have PCOS, that it's not anything other than PCOS. The other thing that happens is the ovaries start to look like follicles or little cystic structures in a string of pearls around the ovaries. And so that's an issue that's due to chronic LH elevation from the pituitary gland, which is your master gland that controls all your hormones. And so there's this chronic LH elevation that causes the ovaries to have theca cells that make too much testosterone. And so that also is not your fault. So people always say, what did I do? I'm gaining all this weight, I get all this hair, it's so unfair, my friends don't have that issue. And I always say it's not your fault. It's partly genetic and partly environmental factors that we don't quite understand clearly. We did do a lot of research when I worked at Cedars-Sinai to really understand what are the genetic mechanisms that cause PCOS, and it is not very clear that it's one gene that does it. It's multiple different genes that cause this issue. And sometimes we could carry those genes and they may not turn on, or they may turn on. That's why I encourage young women to still try to eat really healthy. They can have a free day, one day of the week, Friday night, Sunday night, enjoy yourself with your friends, but the rest of the week to try to be really consistent with eating as healthy as possible. The other thing with PCOS that's really important to talk about is fertility. So some patients say, yeah, I was told when I was a teenager I may have problems getting pregnant when I get older. But what's important is you don't want to take too much time before getting a full evaluation. You want to really talk to your doctor, because if your period's not coming consistently, or you have high testosterone, or your ovaries look like they have the pearl string of polycystic ovaries, it's important to get an evaluation sooner than later so that you could not waste too much time when you're trying to get pregnant. We can help you ovulate with natural ways, with helping you with acupuncture and weight loss, and encouraging you with some medicines if needed to help you ovulate what's called a mature egg, which then allows the sperm to go in to help you get pregnant and achieve your dreams and goals of having a happy and healthy baby. And so ultimately, what is PCOS? It's 2 out of 3 things: either irregular periods, or high male hormone levels, or the ovaries look polycystic. And so it's a compilation of different things. We always have to be thorough and check your thyroid, prolactin, as well as rule out adrenal gland issues that can happen, and they mimic polycystic ovaries. So you want to make sure you got checked for all those issues. And we're happy to see you here at SCRC. All the team here, all our doctors are wonderful and very caring, and wishing you all the best.